It's been a long night hunting. Some little critter's attacking me. I think it just bit me. Man, it sure feels like I've got the flu coming on. I don't feel good at all. You mind getting me some medicine for it?
Sure, 1 second.
Thanks.
Here. Oh. Okay, have a seat. The doctor will be in shortly.
Okay, thank you.
Thank you. Where you in today?
Hello. I've been feeling fatigued with a fever and feeling pretty nauseous and haven't had much of an appetite lately.
Alright. Well, those sound like pretty common flu-like symptoms, so I can give you some, prescribe you something for that.
Oh, I've already been taking some over-the-counter pills and that kind of deal.
Alright. Well, if you don't mind me asking, what happened to your arm there?
Oh, that's just a little bite. I was out hunting a while ago and I got bit by some critter while I was walking back.
Did you get it looked at by a professional?
No, sir. I've been bit many a time.
Okay, well, I'm going to have to run some tests, and I'll refer you to a specialist upstairs just in case it is something more serious.
Is that really necessary?
It is. Some animals can carry the rabies virus, and so we're going to want to get that looked at.
How do you know it had rabies?
Well, rabies is usually spread through the saliva of an infected animal and transmitted to humans by biting or licking any open wound on your skin. Their saliva carries the rabies virus, which is also known as the lyssavirus genus. And this virus is specifically an RNA virus, which attacks your central nervous system, causing inflammation of the brain. And the virus compromises the brain's ability to regulate breathing, salivation, and heartbeat. And when the virus starts infecting the brain's tissues, this is when patients usually start to see symptoms associated with rabies. So I'm going to go order those tests, and I'll send the nurse back in.
Alrighty.
Yep.
Thank you.
So if I do have rabies, am I going to start foaming at the mouth and acting crazy and the such?
Not really. The one that people associate the rabies with, the foaming in the mouth, that's called the furious rabies. There's also the paralytic. The furious is when people are hyperactive and they have erratic behavior, and the paralytic it takes longer to set in, and these people become paralyzed, go into a coma, and then the disease is eventually fatal. And then when the patient starts showing symptoms, that's when the disease is fatal. But the doctor orders some tests, so we're going to send you up to the lab, which is on level 4.
Alrighty, that's a little harsh. We better get up there.
Yeah.
I thought the test to determine if someone has rabies or not could only be done if the patient has already died.
Actually, those tests are only usually done on animals with even the slightest suspicion of having rabies. The 3 tests we're currently running are a biopsy of the nape of his neck, a viral culture, and a polymerase chain reaction on the saliva, and a urinalysis to see if he does have rabies RNA.
Why do you need a skin biopsy from the nape of his neck? What good will that do?
By performing a biopsy, will determine if Mr. Smith has the rabies virus in his central nervous system, and doing it at the nape of his neck is the closest area on the body to the central nervous system.
Okay, what about tests which are non-invasive?
Well, the viral culture and the polymerase chain reaction tests have the ability to detect a positive rabies sample faster than any other test we have. Taking the saliva and isolating the virus found in his DNA, we can determine the amount of cell replication in the cell culture. Another method of confirming a positive rabies diagnosis is the polymerase chain reaction, where once again we use saliva by finding the rabies virus RNA and amplifying it into DNA copies. We do this by copying the rabies RNA into DNA using reverse transcriptase, and this will tell us if he does in fact have rabies RNA.
And if the tests do come back positive, the doctor will be sending you to an infectious disease specialist, which knows more about rabies, and then he can treat you better from out there.
Okay, thank you.
Hello, Mr. and Mrs. Smith. I am your infectious disease specialist. You guys doing?
Hello, doctor.
So, Mr. Smith, unfortunately, your test came back positive for furious rabies. Since you've never received the rabies vaccine when you were younger, the virus was able to infect your body. We're going to have to start treatment on you immediately.
What are the treatments that you will be able to provide for me?
We are going to administer 4 doses of human rabies diploid vaccine over the next 14 days. And we're also going to give you a dosage of human rabies immune globulins, and these will help your immune system fight off the rabies.
Are there any side effects I'm going to have to worry about with these medications?
You should be all right. There is a chance you'll experience some slight nausea, abdominal pains, or headaches, but nothing worse than you're experiencing.
Great. Will these cure me of the rabies?
Well, unfortunately, Mr. Smith, these treatments have not been very successful in the past. Since you've started feeling some of the symptoms of rabies already, your chances of being cured are very much less. If we would have been able to begin treatment right after you were bitten, the chance of curing you would have been much greater. Since I am an infectious disease specialist, we're going to work as quick as we can to address the situation, and if the disease progresses, we can talk about further treatment. Let me just give you some facts. The survival rate of rabies, if the person is infected and not treated with vaccines or taken to a specialist like myself right away, is less than 1%.
Oh no.
Yeah. The average fatality rate after the onset of symptoms is 99%. And what most people don't know is most of these diseases of rabies are contracted through bites of insects or infected animals like canines or domestic pets. Roughly, there's 60,000 deaths worldwide per year. But for you, most of these occur in Africa and Asia.
Those are some very intimidating facts. Is this the only form of rabies that my husband could have contracted?
Well, not necessarily. The 2 most common types are furious, which most people would associate when they think of rabies, and then there's paralytic, which is actually only about 30% of the cases involving humans. When comparing the 2, a patient with furious rabies shows many signs of hyperactivity and erratic behavior, whereas a patient with paralytic rabies will show signs of paralysis around the site of the wound. Here are some basic pamphlets that explain some information for you.
Thank you.
All right, the nurse will be in shortly to administer some treatment. Get some rest, Mr. Smith.
Thank you, doctor.
Okay, Mr. Smith, you may experience some symptoms after I administer this treatment, such as pain or swelling at the injection site, headache, nausea, stomach pain, muscle aches, or dizziness. These are rare, but it could happen, okay?
Alrighty.
Okay, there you go.
Thank you, nurse.
Thank you.
Okay, it's been about 8 days now since you've been admitted to the hospital. How are your symptoms today?
Some of my symptoms have gotten better, but I've developed a few other problems, and every now and then I've had a twitching in my left arm.
We've also noticed some memory loss and confusion while talking.
Okay, well, it looks like your symptoms are beginning to enter the neurological phases of the rabies virus. So I'm going to have the doctor come in and see what his next plan is for you.
Okay, thank you.
Thank you.
Hello, Mr. and Mrs. Smith. How you doing today?
Hello.
Hello.
Doing alright?
Well, since the treatments aren't helping like I thought they would, I'd like to recommend the Milwaukee Protocol treatment.
What is that, and how will that help me?
Well, the Milwaukee Protocol is an experimental treatment that helps save the life of a woman in Milwaukee that had similar symptoms to you. With this treatment, we would be able to medically induce you into a coma with the use of ketamine and midazolam to suppress the brain, and be giving you ribavirin and amantadine, which are antiviral medications to assist your immune system in fighting the virus.
I don't really understand what you mean there, sir. Could you explain that a little bit more?
Well, here's a pamphlet for you guys that might help explain it a little more. But when you are in the medically induced coma, brain function is minimal, which ideally is helping to prevent the virus from working its way to your brain, which allows for the antiviral drugs more time to fight the virus and get out of your immune system.
After you, doctor.
Thank you. He doesn't appear to be getting any better.
His heart rate seemed to be slow, more than usual, and his rate of breath is also a lot lower.
Yeah, I'm not seeing any improvement.
No, not at all.
You want to get in touch with the family member? I guess I will call the morgue.
All right, we'll do.
All right.
Excuse me, Mrs. Smith, the doctor would like to see you.
How is he doing? Please tell me everything's okay.
Well, Mrs. Smith, I really think you should sit down for us to explain this to you.
So as you know, 18 days ago, we induced your husband into a coma, and everything was going fine up until 2 days ago.
And at that point, his nervous system started shutting down, and this led to systemic shutdown of all of his major organ systems. We really did everything we could.
So where do we go from here?
Well, Mrs. Smith, I'm very sorry, but your husband has passed away officially at 4:35 this morning.
I'm sorry. We did everything we could.
Thank you.